everyone, welcome back to my channel. So today I want to talk about something, I've probably talked about this before, just kind of sort of how to weed out fact from fiction, how to sort of, well, not exactly the how to, but why those of us who are chronically ill constantly have to be doing this, having to distinguish whether something is genuine or fake, or if a treatment is legit or not legit. And even in some cases, if a treatment or a test or something is legitimate, and there's science to back it, it doesn't necessarily mean that it's going to do what we would like it to do. So the reason this came up, as you know, I did the exosomes. You can check out the exosomes playlist to see how that's going. Exosomes and stem cells are more or less the same thing. But there are other things that I am looking into now as well. For example, heavy metals testing, and that kind of thing, which, all of these things are very controversial. Stem cells, heavy metals testing, mercury toxicity, even the vaccine. And the vaccine is a really, really good example of something in recent memory, in the recent medical world, that has sparked a lot of controversy, but also has made a lot of people, not just people within the chronic illness community, but everyone, start asking, is this real? Is it fake? Are the side effects and the risks, and the benefits real or fake? A lot of people have been, questioning those things. With the vaccine, obviously it is backed by science. It is backed by a lot of science. There were, trials and things like that. Obviously it was much faster. It was expedited because of the pandemic. And, it's relatively safe. I think for the most part, the vaccine, we conclude that it's relatively safe. But then if you go on the internet, if you go on YouTube or, any social media, there are stories and videos and people saying, the vaccine did this to me and now I have this vaccine injury. I remember it was very popular for a while to see these videos of people either at home or in hospital beds, and it was basically like them with their camera phone, their phone, filming their legs. You couldn't see their face or anything. They just had the camera on their legs, and then they started like shaking their legs, like you could just tell they were shaking their legs. And they were claiming that it was like some kind of a seizure or a tremor or something like that. And I know I might get criticism. Some people may be telling me, why are you laughing at that? These people were sick, or they had a reaction. It was very, very obviously fake. And there are a lot of people out there that are trying to push this narrative that the vaccine is incredibly toxic and it's going to hurt you and you're going to end up with a vaccine injury and that kind of thing. I do believe that there were some people that were injured or had a immune response to the vaccine that, was not great. There are also people that had the, carditis, an inflammation of the heart from the vaccine, and that was actually a documented side effect. That's not fiction. It was documented. I just think the level of attention that's been given to it is not much, because obviously we don't want to scare people away from getting their vaccines. But again, a lot of times we have to question, are we going with this? Are we going with the stories, the shaky legs, the tremors? Are we going with that because we are following, a certain group of people that are just anti-vax or that have certain political beliefs? Are we following that just because we want to go with some kind of group? We want to belong in some kind of group? Or are we able to objectively look at the data and stuff like that and distinguish whether that's real or not, and whether it's worth it for us to get vaccinated or not? So I've been doing this a lot with the heavy metals thing. I looked into it last year. I was going to get, because I still have two amalgam fillings. I had many of them taken out. And I had gone to a dentist because they have to be taken out in a very specific way. You can't just take them out like whatever. You have to go to a dentist that is specifically trained to remove these amalgam fillings, because then mercury gets into the air and into your brains and into your nose. So obviously, I am a skeptic and I question whether this is actually a real situation. So what did I do in that case? I went to, I got a consult with a dentist that specializes in the removal of amalgam fillings. She was very nice. She saw them. She said we could get them taken out in such and such time. She was very eager, and she was very, she's like, we can start today. We can get it started today. We can do one today, or we can do both today. Like I literally had just gone in for the initial consult. So that right away kind of, that eagerness was a little bit off-putting, and I'll talk about that in a little bit. And so I told her, I said, look, I just wanted to kind of get your input for now. I said, I need to speak to my regular dentist and get his take on it as well. And keep in mind, these procedures cost quite a bit. I believe my quote to get just those two fillings removed was going to be, I think, a little bit over $1,000, because I have to get them removed with this special technique, and then I have to get them filled with, composite or with a white filling, afterwards. And so I have to pay the cost of the removal and all of that, which is not your typical removal, and then getting them refilled again. So I went and spoke to my regular dentist, and I talked to him, and he said, look, you can end up with more problems than you had to begin with. He says, if they're not hurting you, if they're not broken, if they're not, if your teeth are not having any type of sensitivity or any type of issue, he says, I recommend that you leave them alone. And he gave me this little printout about amalgam fillings and the mercury and, the risks and whether it's really a big health issue or not. He said you could end up with a root canal. You could end up with extra sensitivity. So he said if they're not bothering you, I would just leave them alone. But of course, if you get on the internet and you start searching mercury illness or amalgam illness, there are all of these stories, all of these tales. There are people. I recently saw a video of this lady that went through her whole history of amalgam illness, and yeah, all these horrible things. I had them all removed, but I was still sick, and I had all this amalgam in my mouth and on my gums and all of this stuff. And finally, it was like this long 10-minute video, and at the very end, she goes, if you want to know how to detox safely and get these removed safely, go to my website. And obviously, at that point, I was like, okay, she's selling something. That's, I think, one of the telltale signs that things may be, that it might be a sketchy situation, whether it's a test that you're pursuing or a procedure or something like that. If they go through this whole thing and then at the end it's like, buy my book, or check out my website, see my program, that can be a bit of a red flag right there. So the eagerness of the dentist was because she was going to make over $1,000 out of pocket. All of this is out of pocket. Insurance doesn't cover this type of removal procedure because it's not a conventional way to remove fillings, and also nothing is wrong with my fillings. So it's not like she can contact insurance and say her fillings are broken, they need to be replaced. So it was going to be over $1,000. So I think that's why this dentist was particularly eager. I mean, to the point where she wanted to start right away, and that was not the plan. I was going in, she was going to take a look and let me know. So you kind of have to question, and when you see that there's money involved, that's always kind of a thing. With the exosomes, I'm kind of coming to the same conclusion. There was some kind of money situation involved. Even if my doctor was not the person that was looking to profit off of this, there was someone else in the equation, and that was something that needed to be factored in. If you're going to get a test, so I'm looking into the heavy metal testing, and they can be pretty, kind of pricey, from $100 to like $300. And I was like, okay, obviously there's a financial gain for this company, but is it backed by doctors? Is a doctor going to look at this test? Yeah, a doctor's going to look at the test, right? So you kind of have to see, are there physicians behind this? Are there actual PhDs, MDs behind whatever test you're trying to get, whatever procedure you're thinking of? Are there doctors and scientists behind this? What is the research saying, right? The research when it comes to stem cells is not saying a lot. It's really not telling us much, especially when it comes to autoimmune illness and Lyme disease. So again, that's a risk, and that's something that you have to take into consideration. Who's profiting, right? Who is profiting? Who is behind this? Like I just said, are there doctors and MDs, or is it chiropractors? Is it an MLM? One of my mom's cousins are going to come and stay with us for a few days, and one of her cousins has diverticulitis. She was just diagnosed with diverticulitis, and she said a friend gave her this tea, and the tea really helped her. And so once she told her friend, like, hey, the tea really helped me, and I would like to get some more, she started telling her, well, why don't you sign up, and you can you'll get all the tea you want, but you also have to sell it. So she obviously got suckered into an MLM. Who knows if the tea really helped her, if it was just some kind of like placebo situation. So, is it an MLM? Is this something that, you have to invest in before you make a profit? I mean, why are you even making a profit off of any kind of treatment, right? If you're the patient, who's behind it? I've spoken about this in my, I think it was like Crooks and Con Artists video, where I spoke about this chiropractor that, according to him, he, recovered his family from mold illness or some kind of illness. And now he's selling his program for thousands of dollars, right? And people, even put, reviews saying this program that you're selling is like thousands and thousands of dollars. Like, why is it so expensive, right? If it's just like a diet and, a protocol. So you have to ask yourself, is this a reasonable price for what they are, for what they're selling? The heavy metals testing that I found, or that I am going to do, is around I think it was $130, $140, which is pricey, but kind of middle of the road when I saw the other testing. And I was like, you know what? Is it going to harm me? That's another question that you got to ask. How much damage is this going to do? A heavy metals test is not going to do much damage. It's a urine test. I don't even have to give blood. I just do it. I follow the directions and mail it back. It's pretty easy. So I was like, whether it's legit or not, yes, it's a loss of some amount of money, but I can afford that loss, and I can just to get this off of my mind. How much peace of mind is it going to give you, right? How much peace of mind is it going to give you to do that test, to do that procedure or that treatment? Is it just something that you have to do because you've exhausted all of your other options? Or is it just something, you have to get it off your mind? It could be another factor in your health, maybe. So it's just good to eliminate that. I kind of feel that way with the dental amalgams. Like, I should just get them taken out. That way I don't have that as an excuse as to why I'm still sick or why I have symptoms or something. That way I can kind of prove it's not that. That's the way that I feel about those amalgams, because I don't want my doctors to have any excuse to tell me, this is why you're not getting better, or this is affecting your health. Because at this point, I think they might be one doctor in particular may be looking for any excuse. Are there studies to support it? Urine tests for heavy metals is kind of supported, I guess, and kind of backed by science. Is this diet that this chiropractor is trying to sell you, is that backed by science? I mean, it just, there's a lot of information for us to go through. And sometimes it's worth it to just go through all of it before you spend this money or invest this money or convince yourself that you have this other issue. sometimes it is difficult to distinguish whether a doctor or, a person or a website or what a testimonial is being sincere or not. And this came up recently when I spoke to the scientist guy that provided the exosomes for my treatment. He seemed incredibly sincere, incredibly caring, very kind, like he really wanted to help. And then at the end of it, I think he just kind of wanted to brush it off and not really deal with it. So actions speak louder than words when it comes to when you're talking to doctors or chiropractors or whoever is selling you whatever it is that they're selling. What are their actions telling you? This chiropractor guy that I was talking about, the one that's selling this diet and this protocol, I went on his social media and he's a fan of very expensive vacations. He's in the Bahamas, he's in Cancun, he's always going to these really expensive, places, taking vacations. I also Googled him and something came up that he is actually, he's been charged with a crime and he's on 16 years of probation, and it was a money related crime. So you can obviously tell his actions were all related to money and related to greed. So you got to look at their actions. What is it that they're actually doing? Because these people come across as very nice, very sincere, very kind, like they really care about your health. But at the end of the day, it's not their words. They may be trying to calm you with their words, but their words are meaningless if their actions are just not great. This scientist that I spoke to, did he go over the blood work I sent him? No, he didn't. He completely ignored it and then referred me out to some of his colleagues, right? And I did look up his colleagues and I did watch, they have webinars and things like that, and I was a little bit skeptical of their work. And again, I looked at their behavior. Did they seem like good people? Did they seem like genuine people? I don't know. It was very questionable. And judging, guilt by association, if they're associating with this guy and I'm not happy with my experience with him, how do I expect these other people to be? And these are his colleagues, right? It is very difficult. And this is, I think, one of the biggest challenges when it comes to being chronically ill, having a complex condition, and also leaving the realm of conventional Western medicine to try alternative things. The alternative world is not regulated, and there are people out there that are just trying to take your money. And they know that you're desperate. They know that you are that you're willing and ready to believe whatever they say. And it's tough. It's tough. I have to say, with the exosomes and the stem cells and all of that, it was very difficult because I had been looking into it for several years. My doctor is an MD. She was leaning heavily towards the exosomes and kind of not warning me, but telling me, stem cells are just not, they're not going to do what you think they're going to do. And she justified it with actual science. And she said, look, this is what the science is showing us. So it is hard. It's hard for us because we're looking for something. Conventional medicine has kind of not really helped us. And we're looking for something alternative, or something different to help us out here. And it's very difficult to distinguish whether something is legit or not. And I hate to say this too, but within the chronic illness community, and I talk about this in other videos, some people are not looking for something legit. There are people with chronic conditions, and health issues. They're looking for the answer that they want. And so they pursue tests that are not legit, not FDA approved. A lot of tests are not FDA approved. Or they're looking for something that is going to tell them, yes, you have this, even if they don't. And, I'm constantly urging, on my channel, I'm constantly urging people to not do that, to ask yourself whether, do you genuinely believe you have this? Or, are you collecting diagnoses? you have to stay focused on the issue, because this works against you, and it works against all of us as a whole. That's why a lot of times we're considered malingering, because there are some patients that are malingering. There are some patients that just want, they want doctors to tell them, you've got this, and this. And at the end of the day, I have to say that it's irrelevant how many diagnoses you have. The issue is getting to treatment. And if you're more focused on diagnosis and not treatment, then why? I mean, it seems kind of pointless to be gathering diagnoses when you're and just disregarding treatment. So it is difficult. It's hard, and I've had other patients recommend things to me. I am not a fan of other patients or other sick people recommending these to me, because if you're still sick, why would I trust that you've got the answer, right? I do not like getting any kind of medical advice from other patients. It's helpful sometimes, but I am not a fan of it. So like I said, consider the source. Be skeptical, be cynical. I did do a video about cynicism. I don't know if it's gone up yet, but I'll try to get it up. It bothers me when I'm swindled. It bothers me a lot when other people are swindled. Sometimes people like to be tricked. They like to be swindled. They like to be told you're very, very sick and I've got the answer. Some of us like to hear that, I guess, but it hurts us, and it hurts our community as a whole, because we really should be looking for an answer, or looking for some kind of treatment, something to reduce our suffering, and we kind of have to have a goal. The goal should not be a diagnosis. It should be a treatment. But anyways, that's another video for another day. Thank you for joining me. Please like and subscribe.